can we cure MASH, or how do we get it better, or what can we do to make it not worse?
Yeah. I think there's multiple things that we can do for people who have MASH. The first, and arguably most important, is if somebody is drinking, they should no longer drink alcohol because we know that alcohol can definitely cause faster progression of the underlying liver disease. Second, this is going back to the sort of simple tenets of weight loss. So diet and exercise. So we recommend typically, a healthy diet. The Mediterranean diet is arguably one of the best studied, although there's no good studies comparing, one diet to the other. So, but it's a healthy diet that has relatively low calories. You want to exercise, 20 to 30 minutes per day. And the goal weight loss is about 10% of one's body weight. We know from studies that if patients are able to lose that degree of weight, that's associated with better long-term outcomes and reduced inflammation in their liver. Now, more recently, we have seen medications come to market that are actually now showing that they can improve the degree of fibrosis, so can help patients with MASH. I think we're starting to see only the first set of these therapies coming to market. We've seen some that target the MASH itself. One of those drugs is called resmetirom. Other ones actually target the larger metabolic syndrome. So the group of medications are the GLP-1 receptor agonists, which can also result in dramatic weight loss in many patients and will help, presumably, the underlying MASH. I think in general, what I'd say outside of any specific medications is it's really starting with alcohol cessation, diet, exercise, and then discussing with a hepatologist what medications would be appropriate for them to see if they can help with their MASH and reduce the long-term risk of complications.